Dr. Pizzi. Would you like to introduce yourself a little bit for our audience at Infectious Diseases Frontier from China?
Okay, good morning, everybody. My name is Maria Pizzi. I am a cardiologist. I am specialized in cardiac imaging. I work here in Barcelona in a university hospital called Vall d'Hebron. We have a big endocarditis team, so I have plenty of experience on endocarditis. And I have participated in the updated versions of the ESCC guidelines and also on the updated version of the new criteria for this disease.
Thank you so much. Our first question is, could you please elaborate on the new changes or updates in the diagnostic process outlined in the 2023 ESC guidelines, and how do these modifications specifically impact or serve as guidance for clinicians in their daily practice?
Okay. Regarding the diagnostic process, we have tried to improve the 2015 guidelines, the previous version. We gave some specific recommendations for all the multimodality approach, including CT, nuclear medicine, which means PET-CT or white blood cell techniques, and also MR and brain CT, and all the techniques that we have to reach the diagnosis from an imaging point of view. So we included some new recommendations, most of them in class 1, and then we also organize all the process of the diagnosis in different specific algorithms for native valves, for prosthetic valves, also a new algorithm for cardiac device infection. So I think we worked a lot, giving recommendations, algorithms to be followed by clinicians, and also in the supplementary material we provided a lot of tips to learn how to interpret images, and I think that those are the most important changes or improvements that we made in these new versions.
Thank you so much. Our following question is, the updated guidelines place a strong emphasis on the significance of imaging techniques, particularly in the diagnosis of blood culture negative endocarditis. Could you discuss the value of various imaging modalities in the diagnosis of IB?
Yes. Endocarditis with negative blood cultures is always a problem because not having the micro criteria always poses a problem, because sometimes when we have to add two major criteria to reach the diagnosis, if we don't have the micro one, it's really a problem, because with images we cannot add different findings from different images. It's only one major criteria coming from echo or CT or PET. Moving beyond the numbers of the criteria that we have, we can use new technology and PET-CT to reach a final diagnosis if we don't have the cultures. And many times in the everyday practice, when we have an echo and we have a high suspicion of endocarditis, even though if we don't have the blood cultures because the patient received antibiotics before, which is the main reason of having negative blood cultures, we accept the diagnosis of endocarditis following the findings of the new imaging modalities. So I think that although it's not improved at all, or maybe we have to make more changes in the future, I think that new imaging, PET-CT and CT can help in those cases.
Thank you so much. And what is your opinion on the utility of molecular detection techniques such as NGS and 16S RNA in the diagnosis of IB?
Yeah. That's not my field because it's your field for the infectologist, but I think that in the same way we support new technology in the imaging field, we have to support new technology to detect microorganisms using all these new tools that you have for the detection of the genetic material or new assays that you can have. So I think that is also a very important aspect to take into account.
Thank you. And our final question is, the new guidelines also highlight the increasing incidence of the CIED-related IE. What key considerations do you believe should be taken into account when diagnosing such infections?
Yeah, cardiac device infections for me is a different entity. It's not completely the same entity as endocarditis. but we have them in the same guidelines, so we have to pay attention to this group. And I think that also we try to organize the information to make some specific recommendations and to put in order the use of the new technology. For example, PET-CT can be used to detect infections in the generator and the pocket, but we still consider that we don't have sufficient evidence for the detection of the infection of the leads. So I think that we have to improve more in this aspect with the infection of the cardiac devices, because they are included in the guidelines, but they are not the same. And I think that the most important modifications that we did is the inclusion of the new techniques also for the diagnosis, and based on the evidence that we have at the moment.